For 2 consecutive days now, the daily death toll has passed 300. Grim figures, last seen back in May. There are almost 10,000 patients in UK hospitals infected with COVID-19. And that figure is rising. The whole of Nottinghamshire will be the latest region to enter into Tier 3 restrictions. The government says breaking the chain of transmission is the only way to stop the spread of this deadly disease.
I think they've lost the plot now. I just don't understand what they're doing. And I think people are a bit baffled by what they're doing as well.
I don't think they've been very clear on exactly what it means. I think a lot of people actually think that we're going into lockdown again.
Really confusing. I'm definitely confused, 100%. Literally, I have no idea what's going on.
The rise in infections is putting pressure on the NHS. Nottingham University Hospitals Trust has already been forced to postpone 4 cancer treatments. The Trust said it was an extremely difficult decision.
Thanks, Rachel.
Prescott has been in Tier 3 for 2 weeks. The medical director for St Helens and Knowsley NHS Trust told me its hospitals were working under a great deal of pressure.
There's no doubt we're busy, and we've got numbers of inpatients that are quietly approaching that which we had in the first wave through March and April earlier in the year. And that brings its own particular challenge because we are keeping our elective programmes running alongside all of that.
Do you think local restrictions are having the desired effect?
We know from the reports of the number of positive cases in the community that that's starting to drop. Are we feeling that translating into a different experience here in the hospital? Not yet, but I wouldn't expect us to.
Are you confident you will be able to cope in the days and weeks ahead?
I'm going to say yes to you because I know that we'll come in every day and do this for our patients. Is it pressured and difficult and challenging? Yes, of course it is.
In England, there are over 8,000 patients in hospital. This compares to 17,172 at the peak in April. We know that most of these patients are in the northwest. Some trusts are seeing more patients now than they did during the peak. In Wales, there are 685 patients compared to 919 back in April. Scottish hospitals are treating 1,100 COVID-19 patients. At the peak, there were 1,520. But Northern Ireland has surpassed the peak for the number of patients it's treating. As of 2 days ago, they had 360 COVID-19 patients, and at the peak, the highest was 322. The Manchester region, another Tier 3 area, will benefit from some extra hospital capacity. Its local Nightingale Hospital will become the first of these specialist surge capacity hospitals to accept non-COVID patients for therapy and social care assessments. At least 4 hospital trusts across England have decided to pause some elective procedures. It's a blow for patients, but with a predicted 25,000 people in hospital by the end of next month, more hospitals may be forced to do the same. Ashish Joshi, Sky News.